Hello, I'm Dr. Kavita Kovi, consultant obstetrician, Aster Women and Children Hospital, Whitefield. So today we are going to discuss about pelvic organ prolapse, otherwise called as mass per vagina. Most of the women are very shy to come to the doctor to tell the doctor that there's something coming out of the vagina. They may not be able to discuss with their family members as well, because still there are a lot of women who feel very disturbed to talk about the mass per vagina or something coming out of the vagina. They feel very shy. So what are the symptoms? What can what to expect and when to see the doctor? There can be fullness or bulging pressure in the vagina. You will feel like passing urine when you just sneeze, cough, that is called distress urinary incontinence. Urge, you feel like passing urine. As soon as you feel like passing urine, you'll run to the bathroom, because otherwise you'll start leaking. You may have lower back pain. You may have a lot of pressure symptoms. You may not be having regular motion. Sometimes a lot of constipation can be there. So if you have all these symptoms, I kindly advise, please go and see your doctor locally, a gynecologist, right? So what can be the reason for the pelvic organ prolapse? So let's understand the pelvic organ first before we understand what a prolapse is. So if you see, this is the uterus, the ovaries, the tubes, and the vagina. So the cervix is always inside the vagina. This is the vagina. So the cervix is always inside. But unfortunately, as sometimes this whole part can be lying outside the vagina. That is called the cervical prolapse or the vaginal prolapse or the uterine prolapse, we call it as. The whole part, this whole part comes out of the vagina. Sometimes the bladder is also dragged along with it, which is an adjacent organ, and the motion area, that is also dragged along with it. So you will see a proper bulge sitting here. So that is called the pelvic organ prolapse or the mass per vagina or the uterine prolapse. Now, why does this happen? Multiple pregnancies, normal deliveries, when they would have made you push even before you're ready to be pushing out the baby. So that can happen. That is called as parity. Multiple, suppose 3-4 deliveries. Even with a single delivery you can have. Sometimes there is a defect in the collagen material. Collagen is the one which is like an elastic material which keeps it in its place. So if there is a deficit in the collagen type 1 and decrease in that collagen, that also can allow the organs to prolapse. There are 3 levels of support. In spite of it, this can sink down or come into the vagina. And this can be because of obesity, constipation, multiple pregnancies. All this can cause the pelvic organ prolapse. So what to do? Please meet the doctor. Once the doctor determines what exactly is happening with you, she will examine you from below. It's very important that she sees you from below and to assess you whether what kind of prolapse it is. Whether the bladder has also come down along with it, which we call it as cystocele. Whether your motion area is also coming out a little bit outside, that's called the rectocele. Sometimes only the cervix would have prolapsed, right? So this is only prolapse or elongation of the cervix, we call it as. So to determine the type of prolapse, you need to visit the doctor. Can this be corrected? Of course, yes. Depending on the age and the requirement of the patient, we can correct this. Some of the patients are really old, more than 80 plus, and they don't want to get a surgery done, or if they have any contraindications for the surgery, we use something called as a vaginal pessary, or we just allow this pessary or the cervical pessary. We just put the pessary into this part of the cervix where it holds up the cervix or it holds up the uterus. So that they are called the pessaries. So they're made of silicone material, they do not cause any infections, and they're quite good. This is non-surgical methods. Some of the surgical methods which we do is we remove the whole part of the uterus. Sometimes it is not required to keep the uterus inside. We of course leave the ovaries inside, but the uterus will be removed through the vagina. There's no point in removing the uterus from above when everything is sagging below, because I need to do a lot of correction or inside the vagina, your bladder correction, your the motion area correction, all that has to be done. The repair has to be done through the vagina. If we do from above, we may not be able to achieve the repairs properly. So this is very important. We call it as vaginal hysterectomy with anterior and posterior repair, anterior vaginal wall repair and the posterior floor repair. So this is a skilled surgery and we do quite a bit of procedures here in Aster Women and Children Hospital. Kindly seek help, kindly seek assistance if you think that these are the symptoms which you have. What happens if you do not take care of it? The whole uterus starts prolapsing outside. You may start developing ulcers on the cervix, which may end up in trouble later. So thank you so much and have a good day.